Now let's begin. Good morning, Professor Stein and other classmates. I'm Xiao-xia Fang. I'm from the affiliated Taihe Hospital of Hubei Medicine University. I think maybe everybody in the meeting, including friends come from China, haven't known this hospital. In fact, it is located in Shiyan city of the Hubei province, which is known as the commercial automobile industry. And also, it is under the foot of the Wudan Mountain, because Wudan Mountain was called Taihe Mountain in ancient times. So our hospital changed its name into Taihe Hospital. That is a simple introduction of my hospital. Now let's begin my presentation. The topic of my talk is neurosis. In fact, neurosis now is called anxiety and phobia-related disorders. It is a general term of a class of disease, which refers to a large group of non-organic mental disorders characterized by anxiety and depression, fear, neurosthenia, and other symptoms. These diseases have different manifestations, but common characteristics. The neurosis includes general anxiety disorder, GAD, panic disorder, PD, and agoraphobia, and social anxiety disorder, SAD, and specific phobia, and separation anxiety disorder. I'm just going to focus on the first two diseases because it is a lot of stuff. Before we learn about each individual disease, let's look at the common characteristic of this disease. The onset was related to psychological factors, internal and external. Patients often have certain predisposing quality and personality foundation before illness. There was no organic linear. The social function is relatively intact, generally without obvious or persistent psychotic symptoms. The general cognitive ability is complete, so they have a strong desire to seek treatment. Okay, let's look at the first disease, general anxiety disorder, GAD. Anxiety in general is our normal reaction to stress. In fact, it can be a good thing. Anxiety motivates you to accomplish your assignments, to study hard for a test, and it can warn you when you are in a dangerous situation. It informs you to be extra vigilant about a dangerous environment to fight or flee. And normal anxiety is more of a friend than foe. It is a normal and often healthy emotion, which is characterized by feeling of tension, worried, and physical change like increased blood pressure. When we face potentially harmful or worrying triggers, anxiety is not only normal, but necessary for survival. We don't face danger every day. Nowadays, normal anxieties revolve around work, money, family life, and family life health, and other crucial issues that demand a person's attention. Anxiety makes us more diligent, cautious, and responsive to the challenge of life. When the duration and the severity of an anxious feeling is out of the proportion to the arranged triggers or stressor, physical symptoms such as increased blood pressure, and nausea and may also develop this response are what we move normal anxiety beyond into general anxiety disorder. GAD involves persistent and excessive worry that interferes with daily activities. People with symptoms of the GAD tend to always expect disaster and can't stop worrying. Now, let's see the definition of the GAD. GAD is a mental disorder with anxiety, and anxiety as the main clinician manifestation. Patients often have unexplained nervousness and significant symptoms of autonomic nervous dysfunction, muscle tension, and motor restlessness. Patients are often able to realize that these concerns are excessive and inappropriate, but they can't control them. So they feel painful because they are unbearable. The cause of the disease is uncertain, but tends to fluctuate. GAD is the most common anxiety disorder. The lifetime prevalence rate is about 4.1% to 6.6%. In the general population, the prevalence rate was 1.9% to 5.1%. The proportion of 45 to 55 years old is the highest. Female patients are twice as many as male patients. A large number of the meta-analysis suggests that general anxiety disorder, GAD, has obvious family aggregation and the heritability is 30 to 40%. The prevalence of the GAD is about 4% in the general population, and it rises to 15% when there are first-degree relatives suffering from the GAD. There are changes in neuroimaging and biochemistry. Now let's look at the clinical manifestation of the GAD. The onset of the GAD was slow. It may be related to some psychological factors. The cause of the disease is often repeated and protracted. The social function of patients was non-cause decreased. Excessive mental anxiety is the cause of anxiety symptoms. Usually, a normal anxiety occurs in response to stressors such as an exam, an upcoming interview, a flight with a friend, or a new job. When you struggle with GAD, you are anxious most or almost all the time, even you can't find the source of the stress. That's free-floating anxiety. And the GAD produces intense and excessive emotional response, even if you are reacting to a stressor and your anxiety is disappropriate to that stressor. That's a apprehensive expectation. And many people are on edge before an exam, but people with GAD might be anxious several weeks beforehand. Also, GAD patients will have increased alertness and become irritability. The patient was restless, kept walking back and forth, and increased armness and small movements and muscle tension and severe muscle pain, and tension headache and limbo trouble. Excessive mental anxiety and worry are not the only symptoms that accompany with GAD. There are physical symptoms too. Patients will have symptoms of autonomic nervous dysfunction, For example, heart pounding, shortness of the chest, dizziness, and headache, sweating, and lightheadedness, and pale and dry mouth, and dysphagia, nausea, abdominal pain, and abdominal distension, constipation, or diarrhea, frequent urination, and etc. And the psychological symptoms are also present. Individuals experience raising our inactive thoughts and are unable to concentrate and have worries about day-to-day things. And because they can't relax, because they can't enjoy themselves, because they can't have good time, they would also have depression, substance abuse, and somatic symptoms. In addition to the symptoms described by themselves, patients have GAD, also have some observable signs which are also less common in mental illness. Some patients may have anxiety expression, blood pressure raise, heart rate increase, and limbo tremor, and tendon reflex active, and other signs. GAD is a disease with a high incidence comorbidities. About 2/3 of the patients were associated with depression, and the risk of the suicide was significantly higher than patients with depression. About 25% of the patients have a panic disorder. Some also have social anxiety disorder and obsessive compulsive disorder. Patients also often have alcohol and substance dependence. And there are also some patients with physical disease, such as functional gastrointestinal disease, hypertension, diabetes.
We just lost your sound. Dr. Fang, something happened with your computer. Can anyone else hear Dr. Fang?
I see.
Yeah.
Oh.
No.
Can you see my screen?
Now we can, yes.
Oh, not speaking.
Okay.
How to diagnose GAD? In an anxiety attack, the patient must have primary symptoms of anxiety for most of the time within a few weeks, usually at least 6 months. These symptoms usually include the following elements: excessive anxiety and worry, and motor tension, hyperactivity, and motor of autonomic nervous system. And the following situation need to be ruled out: anxiety caused by physical disease such as hypothyroidism and hypoglycemia. Anxiety caused by mental illness such as depression with anxiety and schizophrenia, and drug-induced anxiety such as steroid and synephrine, and so on. How to treatment the GAD? The comprehensive application of the drug therapy and the psychotherapy is the best way to obtain the best therapeutic effect. Drug therapy, the first choice is BZDS, SSRIs, and SNRIs. And the beta receptor blockers may alleviate the somatic symptoms caused by autonomic hyperactivity in patients with anxiety, such as palpitation and tachycardia and so on. And the psychotherapy includes health education and cognitive behavioral therapy. Now, let's look at the second part of anxiety disorder, panic disorder. Panic disorder are also known as acute anxiety disorder. It is characterized by sudden anxiety, unpredictable, recurrent, and strong panic experience, which generally lasts for 5 to 20 minutes, accompanied by a sense of near death or out of control. Patients often experience fear of a catastrophic outcome, accompanied by symptoms of autonomic nervous dysfunction. Panic disorder is a chronic and recurrent disease, accompanied by significant social dysfunction. The 1-year prevalence rate was 2.7%, and lifetime prevalence 4.7%. The prevalence rate in women is 2 to 3 times that in men. The average age of onset was about 25 years. It shows a bimodal pattern. The first peak occurs in late adolescence or early adulthood. The second peak occurred between 45 and 54 years old. Now let's take a look at the symptoms of the panic disorder. The core symptom is unexplained sudden panic, then ease and apprehensive expectation in the intermission period. And some people have avoidance behavior. Panic attack when a patient has no special terror situation. He suddenly feels nervous, afraid, and secret with a sense of the dying and out of control, with severe autonomic dysfunction symptoms such as sweating and chest tightness and hyperventilation and tachycardia, dizziness, and numbness of the limbs. It usually lasts for tens of minutes. During the intermission, the patient still palpitation, afraid of recurrence and the consequence of the attack. And that is a apprehensive expectation. True panic attack don't cause really long-term physical harm. Afterward, the fear of another attack can limit someone's daily life. Patients may avoid work to study place for fear of another attack. That's avoidance behavior. Different patients have different course of disease, and the progress will be very different. 30% of the patients have remission within a few years and wouldn't recur. 25% of patients have intermittent seizures. 45% of the patients have poor remission. If the course of the disease is more than 6 months, it is easy to turn into the chronic course. The diagnosis of the PD, recurring panic attacks frequently worry about neurotrack and behavioral changes to avoid attacks can lead to the diagnosis of panic disorder. But we should exclude the panic attack due to physiological effects of certain substances and drugs and medications. This is a more detailed diagnostic criteria. In the progress of the decrease of the diagnosis, they should pay special attention to the identification of panic disorder and organic disease, and don't mistake the life-threatening disease such as acute heart disease and hypothyroidism, epilepsy, TIA, and asthma, etc. for panic attack. Proper inspection is necessary. The two main treatment of the panic disorder are medication and cognitive behavioral therapy, CBT. We usually use antidepressant medication, and the first choice BZDS and SSRIs, SNRIs. Antidepressants usually take effect in 2 to 3 weeks and can significantly reduce the recurrence rate of the patients without abuse and dependence tendency. And BZDS take effect faster, but long-term use may appear tolerance. Okay, that's all. This is my presentation. Thanks a lot. Thanks.